Hi, my name is Yanni, and I will be the nurse practitioner examining you today. So before I get started, I'm just going to sanitize my hands. So at some points, I will have to touch you, so please let me know if at any time you feel uncomfortable or if I'm providing too much pressure. Just let me know, okay? Okay, so starting off, my patient is relaxed, she's calm, she has good posture, dressed appropriately for the weather. Her face is round and symmetrical, no obvious deformities or masses. Her hair doesn't seem to have any lice or any bugs or anything like that. There are no deformities or masses or anything to be concerned about in the scalp. So I'm gonna move on to the face. May I please remove your glasses? Thank you. So sinuses aren't palpable, no masses, no edema. Everything within normal limits. Skin is appropriate for ethnicity. Let me take a look at your eyebrows. They're symmetrical. No deformities, lesions, or masses, or any edema. Same with the eyes. No deformity, lesions, or masses. So I'm just going to press on your ducts a little bit if you want to close your eyes. All right, any tenderness? No tenderness noted. Great. So now I'm going to do an eye exam, and I'm going to start out actually by having you look at me and you tell me if you can see my fingers wiggling. Ready? Okay, great. And now I want you to follow my finger. Awesome. Keep following my finger. There we go. Great. So you have full field of vision and you were able to track my finger and your eyes converged. All right. So now I'm going to shine a bit of light into your eyes, okay? So just look at me. All right, so your eyes are round, reactive to light, and it was equal. Now I'm gonna shine a slightly brighter light into your eyes, okay? Sorry if this one hurts a little bit. And I just want you to focus on something straight ahead. All right. Ooh, try to keep your eyes open. Great. All right, so your fundus was round, no jagged edges noted, no cloudiness, very clear. So now I'm going to test some more of your cranial nerves. So let me know by nodding if you feel this. Are you okay? Could you feel that? Okay, great. And then also I want you to bite down on your jaw. Great. I'm just gonna feel it. Can you bite down again? All right, awesome. And can you smile for me? Frown, lift up your eyebrows, and puff out your cheeks. Great, so your cranial nerve number 7 is intact. Now I'm gonna move on to hearing. And so this is a tuning fork. I'm gonna start by doing a Weber test where I'm gonna place the tuning fork on your head, and then we'll do the Rhine test where I place it just behind your ear, and then when you tell me you can't hear it anymore, I'm gonna put it to your ear to hear the vibrations. Okay, ready? So first, I'm gonna place it on your head, and you let me know when you can't hear the vibrations. Okay. All right, and now the rhyme test. So let me know when you can't hear / feel the vibrations. Can you still hear? Okay. Oh, you have some really great hearing. Okay, I think your hearing is really great since you can still hear. All right, so now I'm just gonna take a look into your ears. But before I do that, I just wanna make a note about your ears that while I was doing the test, I did notice that they were symmetrical, no masses, lesions, edema, or any discharge was obvious from the ear. So now I'm just gonna touch your ear. Tell me if anything's tender. No tenderness noted? Alright, so no tenderness, no masses, no edema noticed, no deformities. And then I'm just going to take a look in your ear. I'm actually going to switch. Okay. So you have a little scab in your ear. Did you know that? Mm-hmm. Okay. Otherwise, your ear canal is really clear. And on this side, yeah, you have scabs 4 in this one. But otherwise, your ear canal is really clear. And let me just look deeper. I didn't do this one, sorry. Let me look a little deeper on this one. Sorry, I just gotta pull your ear a little bit. All right, so your eardrum looks good in both ears. Just a little bit of earwax, but that's normal. So now I'm gonna move on to smell to make sure your cranial nerve number 1 is intact. So if you could just smell this. Can you smell it?
Yes.
Yeah. So cranial nerve number 1 is intact. Okay, so now I'm gonna move on to your mouth. So just by looking at it, your lips are moisturized, no obvious lesions or deformities or any growths or anything like that. Your skin is pink with the normal for ethnicity. And now I just want to take a look inside of your mouth. Okay, so if you could open your first smile for me, actually. Yep, and I just want to take a look inside your lip. So it's pink, it's moist, and then if you could open your mouth, stick out your tongue, say ah. Okay, great. So, sorry. So your soft and hard palate are pink, no edema noted, moist. Your uvula is also pink and moist, no discharge or anything noted in the back of your throat. So everything's good. And because you were able to stick out your tongue and your palate, both of them rose symmetrically. So that means your central nerve, number 9 and 10, is intact. So now I'm going to move on to palpating your lymph nodes. So basically, I'm just gonna kind of lightly touch different areas of your neck and around your ears. So try not to be too tickled by it. All right, so I'm gonna start with your preauricle, postaurical, submandibular, submental. You're doing a good job. Cervical, postcervical, mandibular, clavicular, sorry, and yeah, your, what's it called? Oh, anterior clavicular, your anterior cervical, that's why I didn't name, your anterior cervical and your posterior cervical. Okay, so I'm just gonna switch gloves because my hands feel kind of hot. And for the next one, I actually am going to feel your tongue because I did not do that. So if you could stick out your tongue again, I have fresh gloves on, like all the way out, like how you did before. Out. I just have to feel your tongue for any masses. It'll be really quick, okay? All right. And no masses noted. Tongue is soft and moist. I'm gonna change this glove too. Okay, are you okay if I continue my exam with just disinfected hands? Okay, I can grab another pair of gloves. Give me one moment. Okay, so at this time, I'm going to be taking a look at your trachea, which is your neck. Sorry, let me just put my gloves on. All right, so if you could lift your chin slightly. All right, so I see no deviations, and give me a nice swallow. Great. Okay, so I have another test that's coming up soon. I'm just gonna feel here. No deviations. It requires a few swallows, so I did bring you some water, which I noticed you already started drinking.
This is complimentary.
Complimentary water. Wait, don't drink yet when I tell you to. Okay, so I'm gonna be feeling from the back. I'm gonna do a couple tests from here and then we'll move on, okay? So it might feel a little uncomfortable. Let me know if I'm applying too much pressure. So I'm just feeling for your thyroid here. And is that comfortable here? Can you just swallow for me? Great. Okay, now I can really feel in the grooves to the isthmus. And if you could turn to the right and then swallow again. Great, nice and smooth. And then to the other side, please. Thank you. All right, and then while I'm here, I'm just also gonna feel for your carotid pulses one at a time. So. Okay, great. Do you feel dizzy, lightheaded, anything like that? You still comfortable? Okay, awesome. All right, so at this time, I'm going to move my exam to the rear. to the rear. So I want to take a look at your anterior to posterior angle. So it's a 2-to-1 ratio, which is good. And then I'm just gonna do a measure of your chest. So basically, sorry, I'm gonna wrap this around. And what I want you to do, because I want to make sure that you're getting good breaths in, I want this to be less, the difference to be less than 7 inches. So take a deep breath in and hold it, or I should say out and hold it first. Good. And then take a deep breath in and hold it. Okay, great. You can release. So that was a good chest expansion. I also want you to take a deep breath, and I want to see if you have symmetrical chest rise and fall. So go ahead, take a deep breath for me. Great. And so on this part of the exam, I'm going to be asking you to take a deep breath a few times. So if you start to feel lightheaded, dizzy, anything like that, just let me know, okay? And then we can pause and I can do something else. So your respirations right now are even, unlabored. You seem very comfortable. No Kurzweil's breathing. It's right within normal, 12 to 20 breaths per minute. So now I want to palpate. So I'm gonna feel your back a little bit, okay? So I sense no deformities here. Great. Spine is intact. Awesome. And then I want to percuss, so I'm just gonna thump on my own hands, okay? All right, so no dullness noted. And then I'm gonna take a listen. So this is the part where you're gonna take deep breaths, okay? So deep breath. Again. 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 And again. All right, so no adventitious slump sounds. Can you say 99? 99.
99.
Again.
99.
Again.
99.
Again.
99.
And again.
99.
And now can you say 66?
66.
Again.
66.
Again.
66.
Again.
66.
And again.
66.
And again. And now can you whisper 66? And again. And again. And again. And again. And again. All right, so no bronchophony, egophony, or whispered fertility noted. All right, so at this time, I'm gonna take a quick peek at the front of your chest, and then I'm gonna have you lie down for the rest of the exam, okay? So again, equal chest rise and fall, no deformities noted, very comfortable breathing within normal. Your respirations aren't shallow, they're not deep, they're within normal. Okay, so I'm gonna palpate your chest, okay? All right. Any tenderness? Nope. All right, and now I'm gonna feel between the intercostal spaces, see if I feel any abnormal thrills. Now this time I don't. And then I'm just gonna listen for any thrills or bruit in your neck, okay? All right, so I already felt the carotid, no thrills there, and I'm not hearing any bruits. So at this time, I'm gonna have you lie down for me, please. and just be careful stepping up. Okay, are you comfortable? All right, so, no, let me get my lights. I'm actually gonna have you sit up slightly, like if you could like lean, come back a little bit and then lean your head back on this pillow. That'd be great. Okay, great. So, I'm not seeing any jugular vein distension. And now you can lie down flat now, thank you. So now I'm gonna listen to your heart sounds. So the same places where I kind of just felt on your chest, now I'm gonna be listening to them for your heart sound. Aortic, pulmonic number 2. And then this part might be a little bit awkward for a female, so I'm just gonna use the back of my hand, okay? Mitral. Alright, maximum point of impulse. Alright, great. So while I'm here, this next part can be a little bit awkward, but I do have to feel for your femoral pulse as well as for your inguinal lymph nodes. So basically I'm just going to be feeling like around your private area, but not down there, okay? It can be a little awkward and a little ticklish, so try not to laugh. Okay. So your femoral pulse and your inguinal lymph nodes. Okay. So if you could straighten your legs for me. So your palpable pulses. Great, 2 plus. I'll go to your dorsalis pedis next. I think this one will roll a little bit. There we go. And your posterior tibial. Awesome. Now I'm gonna feel for circulation of your hands, so feel for warm. Hands are a little bit cold, but might be from the water, right? Cap refills less than 2 seconds, and now I'm just gonna feel for your radial pulse. Awesome. And now I'm gonna feel for some more lymph nodes along your arms, okay? Try not to laugh. So that was your epitrochlear. This is your lateral, your central, subclavicular, and then right in here. You have your, I just need to look at my little cheat sheet for that one. Your pectoral. Okay, so do you have any questions about anything that I just did? All right, so you are all set. That concludes my assessment. You did great.